Let's hear from Dr. Nishtha Dalwani, consultant psychiatrist and psychotherapist, Borivali, Mumbai, and let's explore the cause, why people feel really sad over a long time, and learn more about mental health. What's the mystery behind feeling this way, and how can we understand it better? What are the common signs and symptoms of depression, and when should an individual seek professional help?
In India, the incidence of depression is about 10 million cases per year. The commonest signs and symptoms of depression are persistent sadness of mood lasting 24/7 for at least 1 week, sleep and appetite disturbances, low energy levels, lack of interest in pleasurable activities, poor concentration, crying spells, guilt feelings, and suicidal ideas. One should seek immediate psychiatric help if you notice any of these symptoms, that is, having suicidal ideas or experiencing socio-occupational deterioration, that is, problems at work and interpersonal relationships, and having severe disturbances in thoughts, emotions, and behavior. It is very important that the patient and the family members identify the symptoms and seek help at the earliest to avoid complications like suicide, job loss, disturbances in interpersonal relationship, and stress-induced health problems like diabetes, hypertension, heart disease, memory problems, cancer, etc.
Thank you, Dr. Nishtha, for simplifying your understanding of this topic and providing essential knowledge about it. Let's hear from Dr. Nishtha Dalwani, consultant psychiatrist and psychotherapist, Borivali, Mumbai, and let's explore the cause, why people feel really sad over a long time, and learn more about mental health. What's the mystery behind feeling this way, and how can we understand it better? How is depression diagnosed by healthcare professionals, and what assessments or evaluations are typically involved?
As a psychiatrist, we first do a detailed history taking and a test called the mini mental state examination, which helps us to measure the level of cognitive impairment and the changes in the thoughts, memory, and behavior, and helps in diagnosing the different psychiatric illnesses like depression, anxiety, bipolar disorder, phobias, obsessive compulsive disorder, and psychosis. A history of the associated substance, that is alcohol, smoking, abuse, and medical problems is also taken. There is also an online questionnaire available for screening, diagnosing, and measuring severity of depression, which people can take up on their own. It is called the Patient Health Questionnaire 9. It has 9 items, each scored 0 to 3. And if your score is more than 5, it is mild depression. If it is more than 14, it is moderate. And if it's more than 20, severe depression. The National Institute of Mental Health lists 5 levels of depression: major depressive disorder or clinical depression. Then we have the persistent depressive disorder, that is an ongoing low mood called as dysthymia. We have perinatal and postpartum, that is following delivery depression. There is also an entity known as seasonal affective disorder, that is increased in depression during the months of winter and a good mood in summer. We also see cases of depression with psychotic features like suspiciousness and aggressive, agitated behavior.
Thank you, Dr. Nishtha, for simplifying your understanding of this topic and providing essential knowledge about it. Let's hear from Dr. Nishtha Dalwani, consultant psychiatrist and psychotherapist, Borivali, Mumbai, and let's explore the cause, why people feel really sad over a long time, and learn more about mental health. What's the mystery behind feeling this way, and how can we understand it better? Are there specific lifestyle changes that can complement traditional treatment methods for depression?
Well, the traditional treatment methods of depression are giving antidepressant and anti-anxiety drugs, which increase the levels of serotonin. Now, serotonin is a chemical messenger in the brain which is secreted by the nerve cells. The medication improves the mood and the physical symptoms of depression, and it has a positive effect on our thoughts, emotion, and behavior. As far as the lifestyle changes are concerned, I tell my patients to follow the best rule in life, that is BEST. B, breathe well. So we do deep breathing exercises, meditation, and deep muscle relaxation. E stands for eating well. So a diet which is rich in fruits and vegetables, whole grain, meat, fish, reduces the incidence of depression by 35%. Good nutrition prevents memory problems and reduces incidence of dementia. Food which is rich in vitamin A, B, iron, magnesium, drink, and zinc increase the brain function. And maintaining good glucose levels in blood prevents mood swings. Please avoid caffeine, increase sugar and salt in your diet. The third component, that is E, S. S stands for sleep. At least 6 to 8 hours of sound sleep with fixed timings, that is good sleep hygiene habits of going to bed and waking up at the same time every day. Avoid gadgets like TV, mobile, etc. at least half an hour prior to going to bed and waking up. If you do all this, that is you breathe well, eat well, sleep well, automatically you land up in T, that is you will think well. Exercises like aerobics, walking, jogging, gym, all increase the blood endorphin levels. And these endorphins are the happy hormones which make us feel good and prevent depression. Abstain from alcohol, smoking and recreational drugs. Follow a daily fixed routine and take frequent vacations, at least once in 2 to 3 months. Helps. Journaling of emotions and maintaining a diary is also a good practice. Develop some hobbies which you could do over the weekends, and socializing, that is having a good social connect, is a very good factor to avoid depression. Mindfulness therapy, yoga, meditation and stress management techniques also need to be learned.
Thank you, Dr. Nishtha, for simplifying your understanding of this topic and providing essential knowledge about it. Let's hear from Dr. Nishtha Dalwani, consultant psychiatrist and psychotherapist, Borivali, Mumbai, and let's explore the cause, why people feel really sad over a long time, and learn more about mental health. What's the mystery behind feeling this way, and how can we understand it better? What role does therapy play in the treatment of depression, and how do individuals choose the right approach for them?
We psychiatrists offer various therapies like cognitive behavior therapy, interpersonal therapy, behavior therapy, family therapy, psychodynamic therapy, marriage counseling, trauma therapy, stress management, and also online therapy. The commonest therapy is psychotherapy, also called as talk therapy. It is a professional long-term therapy which helps the patient gain insight into their problems and facilitate long-term change in behavior, thought, and emotion. It helps them improve their coping skills. Cognitive behavior therapy, a type of psychotherapy, is the mainstay of depression. It helps us change our thoughts from irrational to rational to develop more positive emotions and behavior. Religious CBT is a new form of cognitive therapy that uses the basic religious beliefs and insights into psychotherapy. Psychotherapy causes changes in gene expression that alter strength of synaptic connections and structural changes that alter interaction between the nerve cells in the brain. After initial assessment by the psychiatrist, once the diagnosis is made and the stressors are identified, guidance is given as to which is the best psychotherapy session to be taken.
Thank you, Dr. Nishtha, for simplifying your understanding of this topic and providing essential knowledge about it. Let's hear from Dr. Nishtha Dalwani, consultant psychiatrist and psychotherapist, Borivali, Mumbai, and let's explore the cause, why people feel really sad over a long time, and learn more about mental health. What's the mystery behind feeling this way, and how can we understand it better? How do doctors determine the most suitable medication for each individual?
We have a varied range of antidepressants and anti-anxiety medication. Depression is an illness which is caused by increased or decrease in the level of certain chemicals called neurotransmitters, which are secreted by our nerve cells. These chemicals vary like serotonin, epinephrine, norepinephrine, and dopamine. Different antidepressants target the different neurochemicals in the brain and achieve the desired relief from depression. A psychiatrist chooses the antidepressant drug based on the patient's presenting complaint, like is it an agitated depression or a retarded depression? Does the patient have sleep or appetite problems? And is there any associated anxiety symptoms like tremors, palpitations, sweating, or panic attack? For the patient who is having comorbid medical illnesses like diabetes, hypertension, heart issues, as we see in elderly patients, there are many new safer antidepressant drugs in the market. Ideally, every depression episode needs medication for at least 6 months with regular follow-up and psychotherapy sessions. Our antidepressant and anti-anxiety drugs are not addictive and they don't have to be taken lifelong. If a patient is suicidal, then supervised medication by a close relative is advised to prevent taking an overdose.
Thank you, Dr. Nishtha, for simplifying your understanding of this topic and providing essential knowledge about it. Let's hear from Dr. Nishtha Dalwani, consultant psychiatrist and psychotherapist, Borivali, Mumbai, and let's explore the cause, why people feel really sad over a long time, and learn more about mental health. What's the mystery behind feeling this way, and how can we understand it better? Are there alternative or complementary therapies such as exercise or mindfulness that can be effective in managing depression?
Yes, 5 minutes daily mindfulness meditation is an effective tool in handling our emotions. There are 5 steps to mindfulness. Accept the present moment without any judgment. Use all our energy to directly handle the situation on hand. Meditate. Focus on your breathing. Get in touch with your senses, thoughts, and emotions. Practice mindfulness during routine activities. We teach our patients techniques like non-judging, patience, accepting things, and letting go. Practice gratitude. Do mindful eating. Relaxation exercises like the deep breathing exercise and Jacobson's progressive deep muscle relaxation helps patients with severe anxiety. Stretching exercises, visual imagery, biofeedback therapy, stress management, and personality development also play a great role. Interpersonal therapy, marriage counseling, trauma therapy, family therapy, and career counselings are also done, depending on the patient's individual needs.
Thank you, Dr. Nishtha, for simplifying your understanding of this topic and providing essential knowledge about it. Let's hear from Dr. Nishtha Dalwani, consultant psychiatrist and psychotherapist, Borivali, Mumbai, and let's explore the cause, why people feel really sad over a long time, and learn more about mental health. What's the mystery behind feeling this way, and how can we understand it better? How does the presence of co-occurring medical conditions impact the diagnosis and treatment of depression?
In my 25 years of practice, currently post-COVID, I'm seeing even young patients presenting with depression along with medical conditions like diabetes, early age, in their 30s, diabetes, hypertension, high cholesterol, thyroid problems, and heart disease. A complete thyroid profile is advised, as increase or decrease in the thyroid hormone can present with depression and anxiety symptoms, as the thyroid gland regulates the full body metabolism. Supplementing with oral thyroid hormones helps in treating depression. Having comorbid physical illnesses increases the risk of relapse of depression by 3 times. Also, the treatment of depression takes long time to recover, and the psychiatrist also has to take care of the drug interactions as the patient is on multiple medication. Also, physical symptoms like chronic pain, body ache, fatigue, headache, sleep appetite disturbances, gastrointestinal problems like nausea, vomiting are seen in depressed patients. Physical medium of expression of our emotional problems is used by the depressed patient, as it is more acceptable by our society as well.
Thank you, Dr. Nishtha, for simplifying your understanding of this topic and providing essential knowledge about it. Let's hear from Dr. Nishtha Dalwani, consultant psychiatrist and psychotherapist, Borivali, Mumbai, and let's explore the cause, why people feel really sad over a long time, and learn more about mental health. What's the mystery behind feeling this way, and how can we understand it better? What role can primary care physicians play in identifying and managing depression?
Primary care physicians should be trained to identify the early warning signs of depression like isolated behavior, mood swings, family and job problems, patient expressing negative thoughts and losing interest in life. They should also have a baseline knowledge of all the various psychiatric illnesses like anxiety, schizophrenia, bipolar disorder, alcohol and drug addiction, phobia, obsessive compulsive disorder, dementia. We are also seeing children problems like attention deficit hyperactivity disorder, childhood depression, childhood anxiety, eating disorders in adolescents, and net addiction and mobile addiction. Early diagnosis and referral to a psychiatrist can reduce the suicide rates, prevent complications, and avoid further socio-occupational deterioration in our patients.
Thank you, Dr. Nishtha, for simplifying your understanding of this topic and providing essential knowledge about it.